Welcome to the fourth video in this series. We're going to be looking at what are the different accountability and community-led monitoring tools. And this is the fourth of 5 videos in this training. The learning objectives for this video are to introduce the key tools and approaches for accountability and community-led monitoring, to support you to consider their strengths and weaknesses, and to make informed choices, and to build your knowledge of successful watchdog roles using these approaches and resources. And we're going to look at 3 different areas. First, the types of approaches and tools. Second, what are the benefits and limitations of these different approaches? And third, data capture and analysis. Let's start with a prompt question. And you can use the worksheet to answer at your own pace, or you can pause this video if you prefer. Thinking about your context in your work, what tools and approaches do you use to gather data for your accountability-based advocacy? So let's look at different types of approaches and tools for community-led accountability. Let's start with shadow reports. These are publications by communities, often parallel to an official report or process, and they can include data or perspectives that might be missing from the official reports or process and could be complementary, perhaps. And they're often used to hold decision makers to account for targets that have been missed. I shared earlier the example of Frontline AIDS prevention shadow reports as a good way to use this for advocacy. And in planning to use this as an approach, it's important to consider who to involve in the process, including allies can be quite helpful. Deciding what topics or priorities it could be useful for, and what you want to report against, for instance, which global commitments, or are you looking at the level of a particular grant or program? Next, we have scorecards, and these measure against indicators developed by communities, sometimes with other actors. They could be healthcare providers, for instance, and they're focused on tracking the performance and quality of often health systems. And they can translate into action plans when they've been assessed by communities and healthcare providers. A great example is Accountability International's country CCM shadow reports and scorecards, Mind the Gap African HIV financing scorecard, and their country accountability scorecards as well. And you can see here a visual example of what that looks like. It can be quite qualitative, and you can create a visualization that's quite eye-catching and easy to interpret with a quick glance of how well a country or an indicator is doing compared to others. You also have focus group discussions, which can be helpful for connecting stakeholders together, getting information from multiple people quite quickly, and if you want to have a way to find if there are sources of agreement or disagreement within a population group, for instance, it's important to create a safe space for people to feel comfortable to disclose information. So you might want to think about whether you only have trans people in a group or only intersex people, for instance, that people would be more comfortable to share very sensitive or perhaps personal stories if that's appropriate. One-to-one interviews might be more appropriate if you need flexibility or you're looking to gather very personal information or qualitative information like stories. These can be useful if it's difficult to gather people all at one time in a focus group. So for instance, if you wanted to speak to someone who's selling sex at the time of day that best meets their needs, that might be outside of normal office hours. So an interview can be much easier to organize on that basis. Community mapping is a step-by-step approach. It moves from the personal to the collective, and it's a way for individuals to make a personal community map that's shared with a group. It's a process of agreeing together where to focus. So that could be on one location, it could be on one community, or it could be a particular issue in a community. So it's a process to support critical thinking as a group about experiences and priorities and biases. And it focuses on real communities rather than idealized versions, which helps make the community-based monitoring more successful in the long term. Setting up complaint mechanisms can also be an approach. It's a way to voice concerns and get them recorded in an official record. And it can provide a mechanism to feed back to health facility managers or district health officials to raise problems. There's a broader category of tools under community or service user meetings and assessments. So this can be different types of assessments or meetings, and it can include reporting community feedback to service providers or decision makers. And it can look at producing reports as well. So the data could collect information on services using community monitors who go and directly observe them. Could use door-to-door services to communicate to people or interview people who are using a particular clinic. And it could be using reporting from service users looking at a patient satisfaction survey, for instance. Monitoring individual cases can also be important if you're looking at things like human rights violations and you want to share examples of individual cases with an ombudsman that then could be used to support litigation, or if you want to submit this to a human rights mechanism like the Universal Periodic Review, perhaps. Case studies are really great in terms of influencing decision makers and getting them to engage with the impact of issues. They can go into detail about the background, the context, and really illustrate the significance of quantitative figures and bring them to life. Health facility committees bring together healthcare providers and community representatives, and they can track and review grievances that might be raised by service users. And they can provide regular feedback as well to how issues have been addressed. Citizen report cards track the quality of health services against certain metrics that the community has decided are important. And these can be used to track progress against national standards, so thinking about the national strategic plans, or perhaps other local indicators or goals. And surveys could be used to get feedback on, say, the quality of services. They can also be used to raise awareness among citizens about the quality of services being provided or reforms that might need to happen. And the survey findings, it's important to put them into the public domain as part of the dissemination of the accountability cycle. And these are best reviewed in meetings between healthcare providers and communities. So this supports overall transparency, and the power of this is in the transparency of the data and in mobilizing citizens around it. So it's a good reference to look at is the Civicus guide it gives concrete steps on how to go about undertaking a citizen report card. You also have health advocates who can be in a channel for addressing healthcare patient grievances in some settings, and they can educate communities on different policy standards and their rights, as well as tracking those grievances. Community observatories we touched on in the case study earlier, but these are bodies that regularly and systematically collect data. This can be from health facility records, or it can be from service users, and they look at quality of services. And they use trained community representatives to gather the data, often working against a baseline. So they do an initial measuring of data and then track change against that over time. Community health observatories are a form of a community observatory, but specifically focused on health, and they might use health monitors or community health workers. And a good example is ITPC's Community Treatment Observatory. And you can see on the image on the right how this interconnects at the different levels with the community, national, regional, and global monitoring and reporting bodies and processes. Monitoring or responding to human rights violations is also a form of community-led monitoring, and data on human rights violations can be tracked in relation to different issues. So this might be around stigma, discrimination, violence, or denial of rights. So it might be denial of access to health services. And these can be used to track information that aren't included in official rights monitoring bodies, or perhaps where communities aren't safe or comfortable to react or report incidents. So a nice example of this is the Rights Evidence Action tool, or REACT. And this is a tool which uses community members who are trained to take interviews with people who have suffered from rights violations or are survivors. And they record the information on the rights violation and then use this to support and refer the person to any services if needed, and to input the data to a database, which is then used to track trends over time and support advocacy using the evidence to implement changes. Finally, resource and budget tracking can be one of the most effective forms of community-led monitoring as a means to hold government accountable to their expenditure and financial commitments made. Tracking spending on particular areas such as health, the amounts going to transgender, diverse and intersex communities can get very specific and targeted and be useful to draw out perhaps the disparities in funding being provided to different communities or different health issues. For an example, look at EANASO's Africa Scorecard on domestic financing for health, which visualizes and ranks per capita domestic spend. And you can see here the green and red symbol, which is quite visually arresting and simple, and a good comparator for how different countries are performing on this. So moving on to the second part of this session, we're going to look at what are the benefits and limitations of different community-led monitoring approaches. So where community-led monitoring adds value is that it brings the right to participation and meaningful engagement to the HIV response, and it helps to embed and advance human rights in that programming. It can give feedback into different processes. For instance, community monitoring contributed to the World Health Organization revising its HIV treatment guidelines in 2019 to recommend that women be given equal access to dolutegravir despite the initial risks identified for pregnant women. It can also provide data on communities that cannot be gathered through national or global programs, and this can help improve program quality. It also gives government officials and policymakers an external view on how to make services more community focused or focused on the clients, the users. And it also gives a more realistic picture of which communities are being overlooked and not reached from the perspective of communities themselves. It provides qualitative data and can also improve the quality of quantitative data. It can give that source of information that helps governments triangulate the data that they have and compare. And it also helps to humanize the quantitative figures through those stories, through surveys, through telling the impact on people at a personal level. It can also provide solutions by identifying the problems and communities knowing what's going to work for them, putting these different solutions on the table that governments or donors might not have considered before can be very valuable. And it helps shift the power to those most effective. On the flip side, you have a few challenges as well. So there are some concerns around the credibility of data that's collected through community-based monitoring. And sometimes officials in global institutions like the Global Fund or USAID and in national governments don't see the value of that data. So sometimes it's not accepted or recognized and might not be taken on board for guidelines that are being developed in terms of planning for program implementation. There are also capacity and funding constraints around this sometimes. So the need for capacity and training of monitors, community monitors. The lack of funding might mean that it's not possible to repeat the exercise at a regular interval or over time. And sometimes it's difficult to get funding for the advocacy work that needs to follow. So it's important to plan that in when you're starting out with community-led monitoring as to what might be possible to achieve. Access to data can also be a barrier, especially if health facilities don't want to provide information about clients. And ensuring independence as well might be an issue when the donor or where you're receiving funding for that work, you might want to investigate the work of that donor, for instance, the Global Fund. So a test question to review the learning so far, and you can use your worksheet to answer on this as well. Can you name 3 community-led monitoring tools or approaches? You could have had any of these answers, but there may be more that you are aware of that you wrote down. Now we'll move on to the final third part of this video, data capture and analysis. So the data cycle is a process of collecting data that has different stages, and these are useful to go through to guide what you might think about in each of the stages as you plan and deliver your community-led monitoring work. So the first point is around getting your concept and planning what you will record. So it's important at this point to define the type of report that you want to produce. And think about how frequently you're going to need to report. Is it going to be every year, every month, every 5 years? What's going to be useful? Think about the indicators and the questions that you want to measure. Think about what responses you might expect to get. This will help your data collection teams know what information they're looking for and how they'll be expected to use it. And you might need to do some training using different data collection techniques or technologies if you're going to use mobile phones, for instance. This is good to conduct at this point. The next stage is to benchmark. This is using baseline information or data that might already be available to establish what the current state of things is. What's the current situation? This is going to be the data that you compare against later on to show how things have changed. Then the next stage is data collection. So this is collecting the data itself, and it could be using any of the different tools that have been discussed and looking at individual stories, observations. It can be looking at quantitative data, qualitative data, and it needs to be collected so that it's ready for analysis. Think about how easy it's going to be to scan the data if it's handwritten, how you're going to export it, how you're going to transcribe if it's interviews, how you're going to summarize the key points and the key findings. It's important to specify the different level of findings as well, if you've looked at facility level, community level, etc. And that makes it easier to select the right people to verify and follow up on those recommended actions. And you can use a consolidated version if you're doing community-led monitoring at lots of different levels. Mobile phones can be a useful way to record the data. They are more discreet, they're familiar to a lot of people, and they often have built-in noise-cancelling audio and cameras that are quite high quality. So there's not a need to buy lots of expensive equipment. Once you've got your data, you would move to the analysis stage. And this is where you're thinking about translating your data into something that can be actionable. So you are looking for trends. You might want to group and interpret the data to identify specific problems. You might want to aggregate the data into the different levels of information that you've collected if you have looked at local, regional, national, global. And this will help to identify issues by the level that they need to be addressed at. For instance, national decision makers might want to know about what province is in crisis or which state or district and how that differs. Then you would move to review and verification or validation. So you might want to set up validation meetings, and these can be budgeted for as well. But this is an important stage. This is like the dissemination stage to relay information to community members and to decision makers as well, if they are part of the process with you, if they're co-creating with you. And you can also use this to discuss how you might want to use the findings for advocacy, and you can use it to triangulate the data as well with other sources. It's important to consider ethics throughout your data collection process and to get informed consent as well. The three key principles are around privacy, confidentiality, and security. Here are some further resources which give detailed guidance on how to approach ethics within your work. The next stage is in the community-led monitoring cycle is engagement and dissemination. This is the step before moving to advocacy. So it's important to disseminate the findings with stakeholders who might have a say in interpreting that data or if it's going to impact them. It's also important to share outside this circle as well. You don't want to just talk to people who have similar viewpoints to yourself. Community-led monitoring creates change by bringing those insights to a broader audience and especially making them transparent. So the aim of this stage should be trying to work towards common solutions with decision makers, because this can be the quickest way to see change based on your data. But if this doesn't create the change you want to see, or if decision makers aren't receptive, you can move to the advocacy stage. And in this part of the cycle, the advocacy and implementation stage, you're looking for crafting evidence and outcomes from your analysis into advocacy messages. You might want to look at doing visualizations of the data, ways that can quickly communicate the trends that you have seen for policymakers or your audience. ITPC's toolkit includes great support and detail on how to use technology to support that data collection and communicating that for advocacy as well. A final prompt question in this session, which you can answer on the worksheet at your own pace. Choose one of the tools or approaches that have been discussed. What will you use it to measure? And how will you use the information in your work? So we've come to the end of this session, and the last and final video will be looking at action planning.